Imagine living in a region of 10.2 million people, where a sudden, severe medical issue leaves you with virtually nowhere to go. Specifically, conditions involving the ear, nose, and throat. The medical field is called otorhinolaryngology, and it is a highly specialized surgical discipline covering everything from chronic airway blockages to profound hearing loss. This animated grid shows the national hospital infrastructure in Zambia. Look at the second-level facilities. Only 5.9% of them are actually equipped to perform essential ear surgeries. When the standard system lacks the basic infrastructure to treat these conditions, patients are forced to seek care outside the public network. That means absorbing crippling out-of-pocket costs just to breathe or hear properly. Dr. Lufunda Lukawa viewed these isolated patient tragedies as symptoms of a measurable structural failure. Rather than treating one case at a time, he decided to step back and map the entire national system to find the exact root cause of the shortage. Healing a paralyzed, nationwide healthcare network requires the exact same data-driven investigation as diagnosing a human body. Dr. Lukama's path to this investigation started in the rural missionary settlement of Ibenga in Zambia's Copperbelt province. A highly competitive merit scholarship placed him at Pelham Secondary School. That rigorous educational foundation set the trajectory for everything that followed. He initially went to university on a government scholarship for civil engineering, but surrounded by aspiring doctors and guided by close mentorship, he made a sharp pivot into medicine to make a direct impact on people's lives. During his training, he saw what happened when severe head and neck conditions went untreated. The extreme lack of specialists meant diagnoses were dangerously delayed, often with fatal results. That realization anchored his focus entirely on the ENT department. Raw brilliance alone cannot solve a national health crisis. It requires a targeted educational pipeline to transform a student from a rural village into a specialized problem solver. By the time he enrolled in a PhD program at the University of KwaZulu-Natal, Dr. Lukama was simultaneously managing an ENT unit responsible for half the population of Zambia. The research process to uncover these answers was grueling. He pushed through severe family emergencies, survived 4 separate bouts of COVID-19, and walked away from a massive road traffic accident. Despite the friction, he executed a nationwide scoping review. He deployed hospital surveys and analyzed massive datasets to map the blind spots in Zambia's ENT care. When seen by non-specialists, 67.4% of ENT diagnoses were completely inaccurate. Because of these errors, half of all patient referrals sent people to the wrong place, actively clogging up the few specialized facilities that were fully equipped. This data finally gave shape to the invisible logistical disease that was paralyzing the country's healthcare infrastructure. Without hard numbers, trying to fix a broken supply chain is entirely guesswork. Accurate, localized metrics are the necessary first step to prescribing a cure. With the bottleneck clearly identified, Dr. Lukama proposed an actionable solution, implementing highly focused short-term training programs for the existing primary care staff. This line chart demonstrates the immediate result of that initiative. After those short training bursts, frontline healthcare workers saw a 33% increase in their functional knowledge. Today, Dr. Lukama is applying these findings directly as the consultant and head of ENT surgery at Ndola Teaching Hospital. His long-term strategy focuses on expanding the native workforce and weaving specialized ENT diagnostics directly into the core of basic primary healthcare. Traditional development models often rely heavily on temporary foreign aid or imported medical staff. Without local specialists to anchor the infrastructure, those efforts eventually falter. True, lasting systemic change in developing nations comes exclusively from investing in local educational pipelines. It takes empowering resilient minds in their own communities so they can return and rewrite the system from the inside out.